All right, so let's talk about working hours for doctors based in Australia. So this would depend on a few things. So if you're a full-time employee, part-time, or casual, as well as the national employment standards that are posted on the AMA website that seem to change on a regular basis. So the most recent standards mention that you're not allowed to work more than 38 hours per week, and every minute after that attracts overtime. And that's just more of a legal aspect of things. Now, the more realistic answer of how many hours you're going to be pulling really depends on which hospital you're in, how well staffed that hospital is, and what rotation you're doing. So, in general, at least from my experience, surgical rotations and more fast paced medical rotations seem to be very busy and have a lot of overtime that you have to complete. Emergency medicine seems to be very well staffed, just from my experience, where I've seldom had to do more than 1 to 2 hours of overtime, depending on what sort of patients I've had. But at the end of the day, it really depends on the staffing of the hospital. Some hospitals are extremely poorly staffed and don't have enough residents on, to basically man the ground. So sometimes you end up doing 2 to 3 residents' job and you're pulling 12 hours per day. I remember when I was doing vascular surgery, there was 2 of us for a huge tertiary hospital, and we would basically, get to the hospital at 7 o'clock and leave at 8. And that was our day every single day, including weekends as well. So it really depends on what specialty you're doing, but normally surgical specialties are a bit busier. And medical specialties like cardiology and RESP are quite busy as well, but it really depends on the hospital size, staffing, as well as the caseload as well. I hope this helps. If you have any further questions like this, just comment below.